Good morning. Thank you everyone for being here for our regular Truckee Meadows COVID Risk Meter media call. Today we have Reno City Council member Naomi Dewar, Jeremy Smith from TMRPA, Master of the Meter I call him, and Dr. John Hess. Thank you for joining us. As always, we're recording this if you need the recording later. These media briefings are also available on the press page at covidriskmeter.org, a great resource to look at as well. And with that, it's my pleasure to introduce Reno City Council member Naomi Dewar.
Thanks so much, Matt, and thank you to our news media for being here. We cannot carry on attempting to manage the COVID pandemic crisis without your help. You are our critical partners to this effort. So we're really grateful for you showing up every couple of weeks to hear where we are, what is the news of the day. And there is some interesting news of the day. It's going to be presented by Jeremy Smith. Dr. Smith, as you know, has been the author of the COVID Risk Meter. Many upgrades have been made over the many months that they've been working, including a new website, translations into Spanish, and new tools. And so with that, I think we'll get right to it and hand it over to you, Dr. Smith.
Thank you, Councilmember Dewar. I'm Jeremy Smith, as was mentioned, and I'm going to take you through the COVID Risk Meter slideshow I've got prepared here. Let's see if I can share it up. Okay, you guys seeing the slideshow? Excellent. All right, so covidriskmeter.org. This is where you can go to get this information. I think the first thing to point out is that you can just take a look at the gauge itself and you can see that we're still in the orange. But I think last time we spoke, we were in the higher tick of the orange. Now we've moved down to the low tick. So the data continue to decline in terms of the incidence of these COVID conditions in the community. And we're going to look at those graphs. But I just want to point out, you can also get information about how to get the vaccine by going to the homepage of the COVID Risk Meter website and click on that. And that takes you to all the good stuff over at Washoe County that can get you hooked up with the vaccine. Okay, so let's jump into the indicator data. So right here, first off, you'll notice that the graphs look a little different. We finally got some automated and interactive JavaScript graphs going on the website. We've noticed that there's a bit of an issue right now on mobile, but I think we've got it fixed and should be fixed today, actually. So the graphs were getting kind of squished, but now they should be working. And it's really nice for me because I don't have to make the graphs every day anymore. So I appreciate that. But what you can see here is risk assessment data. So this is indicator number 1. And this blue line is the 14-day moving average. That's the metric that we use in the model. And you can see very clear that it's been heading down. And in fact, we've got these model score thresholds on the graphs now, and it's well below this orange line. So it's generating 1 point in the model. That's been consistently going down. Likewise, test positivity continues to decline and now is out of the highest category of our model and down into that second highest category. Last I checked, it was about 11.1%. In order to kind of get down, we'll have to get under 7, but we're heading in the right direction. So that looks really positive. No pun intended. So then moving on to indicator 3 here, daily new cases per 100,000 people. You can see the thresholds in our model. They're all kind of stacked down towards the bottom there because when we started this thing, caseloads were way lower. And then we obviously spiked after around Halloween or so, and we're starting to finally come back down into kind of the model world. And now this is generating 2 points. Now we have about 19 new cases per day per 100,000 people as a 7-day average. Back in December, it was up to 80. So quite a difference from where we were. Moving on to indicator 4A, this is hospitalizations. I think what you can see is that the 7-day average is the blue line and then the raw data is in gray, continues to decline. Right now we have around 120 patients in the North Region hospitals that are either confirmed or suspected to have COVID-19. A similar story in the ICU. There was a little bit of an uptick last week. You can see these gray dots kind of shooting back up, about 10 patients, but that's started to subside again. So the ICU condition is continuing to be quite a bit better than it was several weeks ago as well. So I would say at this point, pretty stable. And finally, indicators 5A and 5B. Here's 5A. this is based on overall staffed hospital bed capacity and how many patients are in the hospital in total. And you can see it's under 80% utilization right now as a 7-day average. So we have good ability to accept new patients to the hospitals right now. And even looks even better in terms of the ICU, which is below 65% utilization. So all of that together, all of those great, either stable or mostly downward trending lines have led to this result in our COVID risk meter model. We're down to the bottom of the orange category. For the past several days, we've been registering 5.5. So we're squarely in that low tick of orange. I think, you know, if we start to see hospitalizations or ICU bed use from COVID start to kind of go back up or even stabilize, we might come back up to about a 6 or a 6.5, but we're still, I think it looks pretty good that we're going to be in this lower orange condition, barring some massive change in the way the data are trending right now. So it's looking really good. And the prediction that I think Aditya is not on the call this morning, but his prediction is now, I think, up on our site, and it is for us to stay in that first tick of orange for next week. So things are looking good, and I'll go ahead and stop the share there and stop talking.
So much to cover there, Jeremy, but we can see a very big change. And I know that the team is hesitant to change the meter until they see a real change. Can you just talk about that a little bit and about Aditya's prediction as he made one for next week?
Yeah, absolutely. So every Monday, you know, initially we were really trying to update, and we do update the model daily, but we were changing the risk guidelines, right? And we had many conversations, and just basically determined that even though a model score might be right at the edge between two of these zones, it's unrealistic to think that the risk is changing that quickly in our community. And so we changed our protocol to continue to do the daily scores, but every Monday to check back retrospectively 7 days and look at how the model has performed over that 7-day period. And that really leads us to then set the gauge for that next week. And at the same time, Aditya is running a prediction that's forecasting what that next week's gauge setting might look like as well. And so far, he's been right every time except for once. And I'm thankful that he was wrong that time, because that's when he predicted we would go into that purple setting. So I'm glad we didn't go in there. Otherwise, he's been spot on. To your point, we want to make sure that we don't want to de-escalate too quickly, because we have to be cautious, right? We're not out of the woods yet with this thing. It's just looking incredibly positive right now. So we have our protocol on Mondays where we look at that past 7 days. If 5 of the days, so if a majority of the days by far have shown a score that's lower than the current setting, that gives us confidence to lower the setting on the gauge. Conversely, if only 3 days are higher than our current setting, we'll up the gauge, because we want to be quick to react to the escalation of COVID, but we want to be conservative in how we kind of message around the declining risk. So that's how we approach it.
Well, before we get into the really why has it gone down, because there have been other regions that have seen declines, but we do have some ideas about what is causing this decline. I'd like to introduce Dr. Hess and have him give us a snapshot from what's happening in the field in our medical institution, what he's seeing, and what some of his thoughts are. So Dr. Hess?
Absolutely. Thank you, Councilman Doer. You know, we definitely are seeing declining disease burden throughout the community. You know, the hospital numbers have improved significantly. We have, you know, as we kind of go down and de-escalate in this, the numbers do tend to flatten a little bit. So there's still, I don't want people to believe that there isn't some, you know, modest amount of disease still occurring in the community. It absolutely is, but it's at a very manageable level. So, you know, our hospital systems are not being overly burdened right now, which is a really good thing. So, you know, I think there's a lot of reasons why we have moved in this direction. I think people's behaviors have been a big part of this. I think mask wearing has been much better in the last several months compared to early on in the pandemic. I think social distancing has generally been being followed. I know that travel around the holidays, at least for our community, was way down from where it had been previously, if you look at that data. So there's a lot, I think we need to celebrate as a community. We've really come together and done what we needed to do to drive things in the right direction. One of the things I did mention in our meeting last night is there is a little bit of epidemiology that occurs with this too. So pandemics normally have sort of a wave function. You get a wave of cases and then you get a decrease in cases. And this has been seen with many other epidemics in the past, probably most notably the 1918, 1919 flu epidemic. And so there's a reason it was 2 years. Actually, it was about 2.5 years. So I think it's important for people to realize while the numbers look great, we're really moving in a positive direction. If you look at the past as an indication of the future, we're not out of the woods yet. And there is a possibility, and I think a lot of people in the media have sort of mentioned with the variants, that we could see a substantial rise as early as March or April. That being said, the vaccine has the potential to really change the trajectory of this and potentially eliminate that possibility. But, you know, there's a lot of things we're trying to overcome with the vaccine, mainly supply. And so I can talk a little bit more about the variants and the vaccine and coverage if you have questions about that, because I have done quite a bit of research on that. But yes, we should be very happy. We should celebrate what we've done as a community, but we also don't want to completely let off the gas either, because it is clearly still in the community and these new variants are out there.
Well, I just wanted to talk a minute about what orange means. And just reading from our webpage, to your point, we note there's still elevated risk of community spread. And it's still recommended that we avoid meeting with more than 10 people, continuing to wear masks in public and around especially at-risk people, and strongly consider not attending gatherings. So how do you think we did do with this big gathering with the big game this weekend? What are you hearing?
I think we did okay. I mean, I think that there's always a natural tendency, and I completely understand this, and it's hard to blame people that, you know, as we see numbers get better, people are like, and they hear less about it, right? Because less people are talking about it. They're not getting as sick. We're not seeing the disease. Because such a relatively high percentage of people do have asymptomatic or mild symptoms with this, it is easy for it to reflare. So, you know, we'll see in the next coming weeks. I mean, the Super Bowl, I mean, I know people gathered. They just did. How much and how outside their sort of bubble is going to kind of determine how we do with this. But it is a risk that people did undertake.
And on to just a little bit more talk about the vaccine, which is something we're all focused on. We're all expecting as many people as possible to get vaccinated, but we are very dependent on the amount of vaccine in our community. And so we have both tiers and we have lanes. There's a left lane and a right lane. I know that there's a change going on. We heard from the school district that they've almost got 9,000 employees, and that includes teachers, janitors, bus drivers, community support folks that come in to get vaccinated, which is truly remarkable. The focus has really been on first responders, people like you, Dr. Hess, but first responders like our firefighters, police, REMSA, and then also our school teachers and the entire school system. And I know that the NSHE, the university system, is working too on getting their folks vaccinated so they can reopen, move past a hybrid type approach. But we do show that we have almost 60,000 vaccine doses have been administered in Washoe County. And that means about 12% of our population's received at least one dose. Now, that doesn't include people like me or Jeremy. We are further down the list. We may get to continuity of government eventually, but I think the focus is really shifting to community support frontline staff. And those are your food, your shelter, your court, your social services, and other necessities of life. Really on the other lane, so those are sort of the kind of by job occupation where the focus has been. The other focus has been on our seniors. And we talked a lot last night about how can we help get our seniors vaccinated. Many are having challenges accessing computer systems. They may not have a computer. They may not have a smartphone. Some have flip phones, some have rotary phones. And so some of the sign-up procedures require being able to access a computer and do an online sign-up. So there's a lot of energy and interest in helping our seniors get an appointment. The second challenge is getting them to an appointment. I know that we're talking about at the city, utilizing our firefighter ambulance service. We have a vaccine mobile, if you will, and REMSA has the ability to go provide vaccines on site. So one of the things that we're really looking at is how can we best deploy those tools to targeted populations, either lower income, minority populations, perhaps senior populations. How can we bring the vaccine to them? So first, helping people sign up through the traditional ways that have been established, and second, getting vaccine out to them. Would you like to speak at all about that, Dr. Hess? Maybe add some color or some details to that?
Absolutely. So yes, I think that, we've really kind of prioritized is we know that the elderly are at much, much higher risk of complications. We know actually from some preliminary data coming out of places like Israel, they've seen hospitalization numbers drop dramatically by vaccinating a high percentage of their over 65 population. So that's going to remain a priority, and it has to remain a priority because those are the folks that are most at risk for getting the complications from COVID. So I agree, it's nice to say, hey, let's vaccinate the elderly, but there's a big push. How do we do that? How do we reach them? How do we get them in for the vaccines? I know the health department is actually literally calling people on rotary phones, which is one step, getting them signed up, but then someone has to actually take them. And a lot of these folks have transportation issues. So, I think that the city has got a good plan to try to really enhance that because I know there are a lot of seniors out there that are pulling their hair out because they're like, I can't get signed up, and they don't want to leave their home. So they're literally trapped. So we've got to improve that system. And if there's anything on the media wants to do to try to help us with that, I think that would be incredible because they're the group we're really trying to protect. As far as those frontline workers, I agree. I mean, anybody who's exposed to people on a regular basis, particularly in closed settings, which is our teachers, really, our school district, we have to get them vaccinated. I was really blown away. Krista McNeil last night on the meeting said over 80% of school district staff has received their first vaccine or will have. I think they had one last group to do, but it's going to be over 80%, which is phenomenal and really is going to allow us to move things forward with schools. I know that there's some logistic issues about switching from hybrid to back to full-time in class, but the school district is going to be armed at least with the people that are more at risk, which is the teachers and support staff, by being protected. So some really positive things there.
One ask I would like to make of the media is to try to help us publicize the fact that the Nevada Department of Health and Human Services has actually launched a vaccine call center. And this is to help people throughout the state, but certainly up here. I want to give you the number. It's 1-800-401-0946. So that's 1-800-401-0946. This call center is open from 8 a.m. to 8 p.m., 7 days a week. So it's yet one more resource, for people that are having trouble signing up or have questions about tiers and lanes and, when is it my turn? This is certainly a place they can turn for some help. So we want to get that information out there. And again, our focus on our frontline essential workers, we're really going to be going down in these lanes to, moving past the school district and getting into people who have front-facing jobs, whether those be bus drivers, whether those be grocery store workers, all of your essential services. So with that, I think that it's a good time to sort of close this part of our program and really open it up for questions, because I'm sure media have questions about things we may not have even touched on. So I'll hand it back to you, Matt.
All right, thank you so much. That was great information, and it's nice to see that the meter is, as of now, moving in the right direction. First up, we have Channel 2 KTVN, either Valentina or Jason. Do you have any questions for the panel?
Hey, Matt, quick question for Naomi. That call number, is that for people confused about where to get vaccinated, when they're going to be vaccinated? What is that specifically?
That's that. Plus, it has the ability to help them make an appointment. So, once they determine, yes, you're over 70, we want to help you get vaccinated. The people on that call line can actually help walk them through or do it for them to get them signed up for an appointment.
Okay, so that's for seniors statewide, essentially, or anyone?
It's anyone.
Anyone? Thank you.
Anyone. And there's another place to check as well. And I want to make sure that Washoe County Health District's website. They continue to update that website, and it's COVID-19 washoevaccine.com. So COVID-19 Washoe Vaccine, and I think they probably left an @ out there. So it's probably COVID-19 Washoe. I'm going to actually have to ask our staff because I think it's misprinted on my.
Well, and that's the link that we've put on the homepage of our covidriskmeter.org as well. So it says get vaccine information. It takes you to that.
So that itself is a link, not an email. So there you go. Another good resource. And I checked it myself this weekend and found out that what they're doing is they're actually going through levels, and they're putting in highlight yellow who is next. So there are lists within the lanes, so to speak, and some of the people are shaded yellow. Those are the people that are up. And then there's still people maybe in that tier or that kind of group. Maybe it's even frontline workers who are in white. They're not in yellow. So they're coming next. So you can kind of see who's happening now and who's coming next.
Great. So yeah, for clarification, that's COVID-19 washoevaccine.com. Did we have any questions from Channel 2, either Valentina or Jason? All righty, moving on to Colo, Channel 8. Mike, did you have any questions?
Yeah, for Dr. Hess, what at this point would you recommend for either pregnant/nursing women in the vaccine?
That's an excellent question, because you've gotten two sort of competing statements out there. You have the American College of Obstetricians that's basically are saying we feel like it's safe. We know that pregnant women do carry a higher risk than non-pregnant women, and to when their turn is up to go ahead and get vaccinated. You had the WHO who basically came out and said, we don't have enough data yet. We can't really support whether you should or shouldn't get vaccinated. They didn't say they shouldn't, but they didn't really say they should either. I think I would probably go more with ACOG. And I think that if you're a pregnant woman and your turn comes up, I would get vaccinated. And as far as lactating women, there's no evidence of any kind of harm from lactation. So if you're breastfeeding and your turn comes up to get vaccinated, I would definitely get vaccinated. And it's important to realize too, there are actually ongoing studies in the trials. They haven't stopped the trials, and there were women who got pregnant after getting vaccinated in the trials, and they have not seen any issues with those women. There doesn't appear to be any fertility risk as well. So I feel very comfortable that when it comes to those age groups, to go ahead and get vaccinated.
Thanks, Dr. Hess. How about for Jeremy? Just, I guess the governor's statewide pause is set to expire in the next week or so. Based on what you're seeing, do you feel like Northern Nevada is in a position that maybe that things can be loosened a bit, or is it just tough to speak on behalf of the whole state given what you're measuring?
Well, I think, honestly, I'm not the person that should be weighing in on whether or not how much we should open up. But I do know that this pandemic has had a tremendous impact on business owners and on businesses and families and mental health impacts. And part of that is due to the fact that, in order to be safe and to try to beat this pandemic, we've had to shut things down. And so I think that it's time to start considering. I don't think we want to wait until everyone's vaccinated to think about what are the best strategies for opening ourselves back up. And we should be thinking about and having those conversations now. And what's a reasonable, safe way to start to expand that? And I'll be excited to hear, or anticipate what the governor is going to say about that. But I think, it makes sense that we would relax somewhat if we're seeing some success. But I think it's that double-edged sword that Dr. Hess was talking about, that you don't want to relax too much, right? You don't want to just say, oh, it's fine, now we can just go back to normal, because that's not going to work either.
Dr. Smith, one of the reasons that we made the meter was there is a difference across the state on
Yep.
how communities are being impacted. And we saw a very big difference between North and South. We don't know why, but we were seeing it. And we wanted to capture it and understand it better. And I think that you in your research have also identified that, for example, hospitalizations, I believe, had gone down here much quicker than in Southern Nevada. Is that true? Or what else have you seen?
That is true, absolutely. There's been differences, and it's really difficult to tease out why there are these differences. But absolutely, I think that was a huge impetus behind why we created the risk meter and tried to use local data, that was consistent about here in Northern Nevada, and to capture, how we are doing. I think our mask compliance and our compliance with the standards is very high. And I think that helps, that's been helping with us, and one of the reasons that we're doing so well right now.
Well, and it speaks to the reopening question too. We had hoped to be able to very carefully target what sectors of the economy, how best to open or close as necessary. And I think by having the history with the COVID risk meter, we've been able to really both track where we've been, assess where we are, and predict where we're going. And we're hopeful that information can be used by the governor when they comes to making these kind of complex decisions about the whole state.
Absolutely. And I think, I'm looking forward to the day when I say it's going to yellow, because then I feel like that's really kind of going to be a threshold that we've crossed where, I don't know, for me personally, I'll have a lot more confidence that we're really heading in the right direction. Orange is still high. Orange is still, I think it speaks to how high that big wave was, just how massive, the hospitalizations were and the disease burden was in our community. For months and months and months, way back to March, we were really cruising along at a status quo, a little spike at 4th of July, tiny compared to what we saw over the holidays. So I'm sort of hopeful for the yellow. And I think that's when we really can start to, I think, seriously consider how we're going to open back up.
Thank you for expanding on that, Dr. Smith and Councilwoman Dewar.
Hey, Matt, I heard you calling my name. I was going to ask, what would it have to take for the city to relax some of the restrictions? Was that a yellow, or that tool is not the right way to measure that?
I'll start. The tool, as you said, Valentina, is not the right way to measure that. We set it up as information for people to make their own decisions so that you can know what's going on in the community and you can decide for yourself. It's basically a risk assessment tool. What's going on in the community? Can I even gather with one or two, with masks on? And when can I gather with a larger number, if at all? And so we're really looking to people that are not us. We're good at tracking and analyzing data, but turning that data into a political or economic decision is not where we are situated. I don't know if Jeremy has anything more to add, but that's about where we are.
I agree wholeheartedly. I think, it came up when early on when the school district was interested in learning about the meter and wanted to use it. And I think we were pretty clear that, we didn't design that there are so many intricacies and specificities to a school scenario that isn't something that we considered, right? We're looking at data trends daily just to track conditions and have an honest accounting of what's going on and continue to be that reliable, honest source. So I feel like, I think it rests with the governor and what he's going to do, obviously. And I agree with what Councilwoman Dewar has said, definitely.
Thank you.
All right. Moving down the line, we have either Kinsey or possibly someone else from News 4 Fox 11. Do you have any questions? All righty. Bob from This Is Reno, I know you had a question earlier. Did you have any follow-ups?
I don't. I'm good, actually. Thank you so much. I enjoy this this briefing every 2 weeks, and I hope we continue to do it as we need. So thank you.
Yeah, thank you. And we'll wrap it up here with the Reno Gazette-Journal. Kristen, did you have any questions?
Hi, yes. So can you speak more about vaccinations and the importance of following the line and lane structure? I know the governor put out a statement earlier saying that leaders shouldn't skip lines and put their families first, but could you speak more about that and what you're seeing?
Well, I'll be happy to, and then others may want to chime in. I will tell you that I would say, other than the initial confusion at the beginning of the vaccines, I think everybody's got the message. I think it's very clear. You know, just for example, neither Mayor Nashivni nor I have gotten vaccinated, and we don't expect to for quite some time until it's our turn. We're in different categories, you know, so she's in one, I'm in a different, but our turn will come when our turn comes. And I think it's super important for leaders to lead the way on this. So there's very few people that I know have, quote, jump lines. In fact, the challenge is really just getting the people that are supposed to be in the line, get them their vaccine. So people that are over 70, I mean, that's where our focus has been. And I'll give an example. Mayor Shivi explained she spent quite a bit of time last week just trying to get 3 people that are over 70. In fact, one was 99 and one was in her 80s, just get them their vaccine. And it's as challenging for her to navigate this, or it would be for me as anyone. So we don't get to call up and say, hey, I've got a special person that really needs to get vaccinated. We don't get to do that either. So we're all, but we can facilitate. We can help those that are in line and it is their turn to actually take their place. Some of the challenges that we've seen, again, are in some underserved communities. People just either don't know about it. The information hasn't gotten out to them. They don't know how to access it. Maybe they don't have a personal doctor, a confidant to call. And so that's where we're finding the younger generation is coming to the rescue. Many of them have high facility with using cell phones, computers, and every other kind of whiz-bang device that you can imagine. And if there's a way, they're going to figure out how to get their grandmother or grandfather vaccinated. That's what we've seen. And that's really been the role of our leaders, I think, is facilitating getting those whose turn it is vaccinated.
All right, great. Any more questions from our media partners? Perfect. Dr. Hess, before we move on to closing remarks from our panel, if we have any, I wanted to ask if you could kind of clarify your affiliation in the local medical community, because I've seen you quoted in these risk meter stories, and I think you may have moved on to a different practice. So if you could quickly explain that.
Thank you, Matthew. Yeah, no, I was with St. Mary's for several years. In the last 2 months, I've myself and several other doctors have formed a new medical group called Pinnacle Medical Group. And so, yeah, if you do quote me, if you could just make sure to put that I'm with Pinnacle Medical Group as opposed to St. Mary's, I'd appreciate that.
My closing comment would probably be this, that sometimes it takes a few months and sort of a look back to realize how far you've come. When Jeremy and I sort of started in on, can we make a COVID meter? We began to realize that data was not readily available. And both of us are kind of data nerds. You know, I'm a scientist in my other life from being a council member. Jeremy's a scientist all day long. And we began to realize that the data streams were not uniform. Sometimes the same numbers were reported differently by different groups. There were different confidence levels, in other words, bands, error bands that would be used, rounding that would be used. I think one of the greatest things that we did, besides develop this COVID meter with a much larger team, of course, was to really hone in on who had the best data. And along this way, I've heard from people, well, I just rely on the Washoe County Health District website, and that had some great data for a long time until we began to see some cracks on a few things, and those were taken off the website. Jeremy and I reached out to the state of Nevada, to their top epidemiologist, their data scientist, and she shared with us, and she told us that because of the questions that we were asking, she was actually starting to look at her own data differently and actually select different parameters that she thought would better explain the story. So I think if there's one thing we've accomplished, in addition to everything that you probably know about up front, is behind the scenes, getting good data on which to make decisions. And Jeremy could probably speak a little bit more to that, but it's one of the things I think I'm most proud of. On the COVID risk meter, this data comes from a variety of sources that we've deemed the best source for that thing. So could you just address that for a minute, Jeremy?
Well, absolutely. I think you're speaking my mantra right now, that data, right, and reliable and, good consistent data is really the hallmark of good decision making. Having that at your disposal, you don't have to have a computer model that tells you what to do, but it's incredibly important to compile the information that describes a given thing we're trying to make decisions on. So absolutely, one example is test positivity. In the beginning, no one was even tracking test positivity. The first measures of test positivity that I received were from Kevin Dick at the health district, where he'd just been going to the state site and, capturing a screenshot and doing kind of a back of the napkin thing. So there was at least 3 or 4 different ways that was being measured. And how do you set model thresholds that need to be consistent if there's all these different data sources? So we did work with the state to hone in on that test positivity measure. We did a ton of work with Christopher Lake and the Nevada Hospital Association to make sure that we absolutely understood what those numbers meant and what was being reported, and we tested the validity. We've been looking at monthly averages. We've had many conversations, to test that. The Washoe County Health District has been instrumental in providing really good day-to-day data on cases, which has been fantastic. And so that's where we get that information. And then it was the health district as well that thought, hey, what a neat idea to have a leading indicator like the risk assessments. It's really kind of the first thing that we start to know about. People are calling in to get a test because they're not feeling good, or they're for whatever reason. But when those number of tests are going up, I mean, that's really the leading indicator, as opposed to, early on in our model, we were thinking about using deaths. And, there is definitely merit in understanding what has been happening with COVID-related deaths, but it's a very lagging indicator. And so it was one that we decided wasn't appropriate for the model, but it's something we keep our eyes on. So I think absolutely having consistency of data, vetting the reliability, right, and building consensus with data is what we've been trying to do. And in fact, if you come to our regional planning meetings, you'll see we're trying to do that with land use as well. So.
Well, and just a testament, I know I know you're looking at doing a research paper on this now, because so many people across the country have been interested in how we develop this meter. Also, I know that there was a request from, I think it was UC Davis, to give a presentation to their docs about this meter and how we developed it. So I think, if we've moved the world forward here in Reno, Nevada, it's just trying to get a handle on this data, trying to make it understandable to people in a simple way so they don't have to become experts on test positivity and going to Chris Lake at the Hospital Association, figuring out how many people are in the hospital, but could have a simple way to really synthesize the information. And it's making us do better data analysis in other areas, like Jeremy just spoke about. I'm chair of regional planning. He's the director. It's a data intensive agency. That's what they do all day long, is analyze data. So as the COVID crisis moves forward, perhaps some of you will get interested in that kind of information about our town. Growth patterns, population patterns, water infrastructure, all the things that make up Reno as Sparks and Washoe County. So I think with that, we'll sign off, and so appreciate you. That's the final message I want to give, is that we could be working just in a bubble doing our data thing, or the hospital folks could be just doing their treatment thing. But unless you are there to report the story, let people know what's going on, the information resources they can utilize, how they can get help, these 1-800 numbers, these websites, our community is not moving forward. So huge shout out to all of you that are helping us move our community forward. So again, thank you for attending today, and we'll see you in 2 weeks.
Thanks all.
Thank you, everyone.
Thank you.